Today I'm going to share with you all my treatment presentation for Logan. It'll be presented by me, Rebekah Lopez. Logan is a 3-year-old female. She comes from a biracial family. Her mother's name is Seda, and she is Iranian, and her father's name is Colin, who is Caucasian. Her occupational roles are both daughter and sister. She lives with her mother, father, sister Avery, and her cat, Nala. The family lives in Union, New Jersey, in a first-floor apartment. Logan has a very strong attachment with her mother. About 3 months ago, Logan was diagnosed with Lyme's disease after a hiking trip she had with her family. Logan has been displaying issues with her sensory system and since has been diagnosed with tactile defensiveness. She comes from a middle-class family. Her mother is an elementary teacher, and her father is a police officer. Logan will be receiving services at the Sensory Tree Outpatient Pediatric Clinic in Red Bank, New Jersey. Logan will be seen twice weekly for 40-minute sessions. Past occupations Logan used to enjoy include playing with Play-Doh and paint at the daycare. Logan enjoys chasing and petting Nala, their 10-pound tabby cat, and swimming at the YMCA with her mom, dad, and sister, as they go every Sunday afternoon. Due to Logan's recent issues with tactile sensations, she has been unable to engage in these occupations. Her present occupations include playing dress-up, dependent on the costume, playing with Barbies with her sister, as well as dancing. Logan's family first began seeking services due to the outburst Logan was displaying when donning a life jacket. This is a social participation and leisure occupation that the family engages in regularly and thoroughly enjoys. This was abnormal for Logan because prior to contracting Lyme's disease, Logan loved swimming and gave no issues when donning a life jacket. Through treatment, the family would like to resume the following occupations in the future, which include playing with her family at the YMCA, playing with Play-Doh at daycare, as well as playing and petting Nala. In the evaluation stage, the PEOP, as well as the Sensory Integration Frame of Reference, were used. The Sensory Integration Frame of Reference warranted the use of the sensory profile assessment that was given to Logan and filled out by her parents. The PEOP model was also used in the evaluation stage, as it has a heavy emphasis on the environment. The PEOP was helpful in guiding the occupational profile and further evaluating the family, their social environment, and their physical environment related to the life jacket. The PEOP helped gain knowledge of the life jacket and the physical components of it as it relates to the sensory issues that Logan is experiencing. Both of these models and frame of references will be continued to use in the treatment stage of Logan as they are still relevant. The assessments used in the evaluation stage include an informal interview, which was used to obtain further information about Logan's interests, her likes and dislikes, and some of the areas her parents would like to focus on. A task analysis of donning a life jacket was also performed and allowed for the consideration of all the various sensory systems involved with this task. There was also an observation of Logan donning a life jacket, which was performed in the pediatric evaluation room, and a sensory profile assessment was used to find out the specific areas of sensory Logan is having trouble with and how they are impacting her functioning. Logan's parents filled out the sensory profile. The intervention approaches utilized in this treatment will include the create and promote approach, which will be used because Logan and her parents can benefit from enhanced performance in the areas of social participation and leisure. Throughout the session, I intend to educate both Colin and Seda in appropriate play for Logan, as well as the different sensory techniques that can be implemented in the home in reference to the sensory diet. An establish and restore approach will also be used, and this is due to the fact that Logan once had the skills necessary to engage with tactile stimuli. However, currently, due to the sensory deficits she is experiencing, is unable to do so. As connected to the PEOP, the person has an intrinsic motivation to explore and interact with the environment. However, in Logan's case, the sensory deficits are causing issues, and therefore restoring the ability to interact with the environment will increase Logan's occupational performance. This is also consistent with the sensory integration frame of reference, as the change is seen as occurring through the interaction with the sensory stimuli. These two approaches will be utilized concurrently. The intervention that will be seen today is my first session with Logan. You will see that I am educating the family on Logan's sensory needs as well as how they can implement the sensory diet at home. This is consistent with the create-promote approach. Following the educational session with Colin, Logan's father, I will have Logan engage in a few preparatory tasks to further educate the family in the methods that can help calm Logan throughout the day. Hi, Colin. I just wanted to check in and see how Logan's been doing.
She's been doing all right. We've been going to the Y lately, and every time we go to the Y, she doesn't want to put her life jacket on, and she'll cry every time we try to put it on, so we can't, as a family, enjoy going out swimming and stuff like that. So it's been really frustrating a little bit, and then at home too, she doesn't want to play with the cat. She doesn't want to touch the cat. And Play-Doh has been a big thing too. Like, she doesn't want anything to do with it, so.
Okay, and that's been, I guess, pretty rough. Has she been having any outbursts or anything?
Yeah,
or are
she has.
Yeah.
Yeah.
Like, what type of outbursts?
Like temper tantrums.
Okay, yeah. That sounds about right. From the sensory profile that your wife filled out and from my own observations, it appears like Logan is having what's called tactile defensiveness. So basically, Logan's body responds to touch sensations very much differently than how we respond. Touching something that's rough or slimy probably wouldn't make you feel like you were in any pain, would it? No, but for Logan, it does feel painful, and her body goes into this defense mechanism, and so she's probably having her outbursts because of that. So through our therapy, we're going to be working on basically implementing different touch sensations slowly to help her better be able to deal with it and tolerate it. So we're going to use what's called a sensory diet. I don't know if you've ever heard of that. Have you? Okay, so it sounds like it's about food, right? Yeah, so it's actually not about food, but we can use a food analogy to better understand what a sensory diet is. Basically, a sensory diet, let's think about how we are when we're hungry. Have you ever experienced being angry or acting out of your normal self because you were hungry? Yeah. Okay, I've definitely done it myself too, and that's fine. Basically, because you don't have the nutrients that you need, you're starting to feel very much out of your own character. And similarly, Logan, her body is craving nutrients in a way too, but those nutrients are sensory stimulations, and because she's not getting the sensory stimulations that she needs, she's acting out of character. And through the use of the sensory diet, we're going to basically feed her body those sensory stimulations that she needs, and that should hopefully help her be able to deal with those aversive sensations in a more, calm manner. So basically, I wanted to talk about the sensory diet implements those nutrients. We're going to be implementing sensations that can be particularly calming to people who have tactile defensiveness like Logan, and this can be through what's called proprioception, which is like the sensation that you get from deep pressure that really like works on the joints and the muscles and the connective tissues, and it can be very calming for someone who has this aversiveness to touch sensations, as well as what's called vestibular input. So that's kind of the like knowing, when she knows where her body is, it'll feel a little bit more comforting for her. And both proprioception and vestibular input can help her kind of be aware of where her body is in that present moment. So I actually have a brochure for you today, and it's for a sensory diet. Now, this is not all inclusive. It's not a cookie cutter type of sheet for you to follow, but it does have some different activities that you can look at, and it'll give you an idea of some of the things that you guys can do at home. So something that you could do for that proprioceptive, that deep pressure input, is having Logan crash through the couch pillows. You know, that can give her that deep pressure. Or even something like wheelbarrow walks. I've actually highlighted a few of the things on here that I feel are appropriate for Logan given her age, and you can do these things at home. One of the things that I highlighted that you might feel like a little taken aback was help wash the windows or tables. But Logan's at that age where she probably likes to be a helper, right? Yeah, most kids at this age do like being helpers, so I thought that maybe having her help you wash the windows or tables might be a great way for her to get that sort of input that her body is really craving and needing right now. And like I said, wheelbarrow walks is another great way. I noticed that in our interview, your wife had mentioned that Logan loves baking with her. Is that right? That's awesome, because
she makes a mean carrot cake.
Really?
Yeah.
That is awesome.
Yeah.
So she can maybe do some stirring, and that'll give her that proprioceptive input that she needs. Another thing you could have her do, if you want to change your routine a little bit, I don't know if you guys read to her every night or not.
Yeah, we do.
You do? Before bed? Yeah, that's a typical routine that I think most parents have, and that's really awesome. So maybe if you'd like, you could have Logan carry her books out to the living room or somewhere, maybe to your room, carry them to a different room, and you can read it in a different room, and then bring her back into her room where she can bring the books again, because that'll give her that deep pressure. So some of the vestibular inputs that you can have her do are, swinging on the swings. I don't know if you take her to the park or not, but that could be very calming for her. Doing merry-go-rounds, you and your wife and your other daughter, Avery, could probably all do that together. Cartwheels and somersaults, she's much too young for, so you wouldn't have her do anything like that. But there's actually a yoga move that she may like that can really give you a lot of vestibular input, where you basically just stand up and then you lean forward, you bring your arms together, and you kind of just move back and forth. And this could be really calming for her, and you could have her do that and see how she likes it. And on here, there's other types of input that she may or may not like, but we're going to focus mostly on providing her with that proprioception and the vestibular input. Okay. So I'm going to give this to you, and I'm going to let you keep that. Okay. Remember that, Logan's body is craving these inputs, and you need to implement them every single day. But there may be days that she doesn't want to do a certain activity that she may have liked every other day, and that's completely fine. It's just like eating your favorite food. I mean, you eat your favorite food every single day, and you may not want it on the weekend because you've had it 5 days in a week. So that's fine. And if you notice that she's feeling, she's having tantrums, if she's in pain or anything like that, then it's a no-go for that day, and that's completely fine. You just can find another activity that works for that day. There's several different activities on the list that you can choose from, and that I've highlighted for you. So, yeah, those are just some of the things that you want to keep in mind when you're doing this with her. You don't want to push her to do anything she doesn't want to do.
Okay, sweet.
So how do you feel about that?
Good.
Do you feel like it's something you could do at home?
Oh yeah, definitely.
Yeah.
Yeah.
Okay. Okay, well, I hope that you and your wife are able to do this at home, and I just want to keep an update every day, not every day, excuse me, like every session, if we could just update each other on how it's going, just so we can see and see where Logan is at.
Okay.
All right, Logan, do you want to do some jumping on the trampoline? Okay, let's go. All right, Dad, so like I was telling you earlier, there's calming sensations for Logan, and proprioception is one of them. Jumping on the trampoline is a great way to get that sensation, and as you can see, Logan is really enjoying this. Okay. Another way you can do is through wheelbarrow walks, like I mentioned before, so I'm going to show you how to do that. Okay, so wheelbarrow walks are another great way that you can implement at home. It's really easy, you don't need any equipment, and it will give Logan that type of sensation that she needs. So I'm going to show you how we do it, but I'm sure you remember because I'm sure you did this as a child. Uh-oh, you okay there? How do you like that, Logan? Whoa, we're losing a leg. Nice job. Okay, I'm going to put you down. Sweet. All right, Dad, so does this look like some things that you and Mom can do at home?
Yeah, definitely.
Okay, so I guess I'll be seeing you next week, and you can follow up and let me know how everything went, okay?
Thank you.